Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to Direct Connection. Coming up tonight, expert advice for parents-to-be and their family members. We'll talk about pregnancy in the time of COVID. That is coming up. First tonight, several Maryland counties rolling back their reopening plans in the face of higher coronavirus testing numbers. Joining us now is Anne Arundel County's Health Officer, Dr. Nilesh Kalyanaraman. Sir, thank you for being with us. What changed there on Friday?
Thank you for having me, Jeff. So what we've been seeing in Anne Arundel County is that for over 4 weeks now, our cases have been going up. And we were also seeing that for 2 weeks, our hospitalizations were rising as well. And one of the things that we know is that there's a lag between cases, hospitalizations, ICU stays, and death. And so when you start to see those hospitalizations rise, it starts to increase your concern. And so we knew that it was time to act. And that's why we made some changes that went into effect this Friday.
And with those changes, what do you want residents of the county to be doing and not doing?
Mm-hmm. So what we saw when we looked at our contact tracing data, we saw that there were a lot more cases in the mid-teens to the mid-30s age group. It was still across all ages. And in that group, we were seeing a lot more contacts per case, so 10 to 20, instead of before when it was below 10. And we were seeing that parties, bars, restaurants, malls, and shopping centers were the most common places they were going. So we really wanted to target our changes to address that because, unfortunately, not everybody's following the distancing and the masks to prevent the transmission. So we essentially made it so that you can't hang out in the mall. You can go to the stores, you can go to the food court to get food, but you can't sit there and hang out. We restricted gatherings, social gatherings, to be 25 indoors and 50 outdoors. And bars and restaurants have to close at 10 o'clock indoors. And that's really to cut down on that late night drinking, socializing. And we're going to increase our enforcement. And really these steps are needed because honestly, people aren't doing what they should be doing because they think that they might be safer because they're younger.
I'm having trouble hearing. I don't know if it's just me or everyone, but doctor, if you can hear me, what do you make of what's happening around the country, where certainly in the Sun Belt and to the South, and I don't know why it's the South, but we're seeing big increases, certainly compared to what we have in Maryland. Yeah.
So one of the things that we saw in the Sun Belt is that there was this sense that it had happened in the Northeast and it wasn't going to happen down in that Sun Belt area. And so they were reopening. And because of that, there was greater spread and they didn't act fast enough. So once you start to see the cases rise, if you don't take action, it's going to keep shooting up until it becomes so obvious with hospitalizations and ICU stays and deaths that you're forced to take action. And I think that's one of the things we thought about is how do you make sure you take action quickly?
What's the access to testing like in the county? And I'm thinking not only getting a test, but getting the results back. I know somebody who had a test 16 days ago, still waiting for the results at which point it's a moot point, right?
Yeah. And that's the right point. There's access to getting a test, but getting the results back is the other side of that. And different labs are getting results back in different timeframes. So we're seeing that the timeframe now is down to about 3 to 5 days for many of the labs, but some of them are still at 7, 10, even 14 days. And that makes it really challenging because that makes it less likely that somebody might want to get tested. And if they do, like you said, what are you going to do with it after 16 days?
Let me remind our viewers, if you have a question for the doctor, you can call the number that we'll have on the screen. You can also email it to livequestions@mpt.org. Doctor, my impression had been that, and not just the coronavirus, but similar diseases were harder to transmit outdoors just because maybe the weather's warm, maybe you have a breeze blowing. Is that correct, do you think?
That is correct. It is generally harder to transmit outdoors, but that doesn't mean it can't be transmitted outdoors. And so when you have people in more crowded situations or in areas that are confined, that virus is more likely to circulate. There's a lot of work being done on how far the virus travels, and it can travel a good distance beyond just a few feet in front of you. That's why we have the 6 feet, and that's why we have the mask recommendations as well outdoors in Anne Arundel County.
Doctor, here's an email question from somebody who wants to know, goes to the gym. There was no policing of a mask policy at the gym. I'm wondering how safe it is to work out at the gym when others are walking around not wearing masks. I think I can guess the answer to that. How safe is that?
So gyms are actually one of the questions we get the most about. And while we certainly recommend that people wear a mask, we also recognize that it's hard to work out with a mask on. And so our general recommendation is maintain the distancing, wear the mask if you can, but also recognize if you're not comfortable in that setting, you can leave. There's nothing that says you have to stay in the gym and expose yourself if you don't feel like it's safe.
What's the takeaway for you from the Major League Lacrosse tournament that was held in your county over the weekend, over the 10 days before that? We know Major League Baseball's in turmoil. The Orioles were supposed to be playing. They can't play because 12 Marlins players have tested positive. Both teams possibly on their way to Baltimore. The lacrosse tournament, they set up what's called a bubble. Everybody was in one hotel, yet at the end of the week, they had a couple of positive tests. What do we take away from that?
I think we take away from it that a lot of the preparation and work that we do are meant to minimize the chance of transmission. And reading through what protocols they had in place, those were good protocols, but there are certainly some aspects of that where the players had to get their own test, which leads to longer lag times for test results. But at the end of the day, all of these safety measures decrease your risk. They don't eliminate it. And so I think one of the things that we took from that is they made it all the way to the semifinals. They were doing all that work, but it can happen at any moment. We're seeing with Major League Baseball that happened 4 days into the season. I think MLB was hoping they make it a little bit longer than that. But it has implications for how we do other things, including school. And that's one of the biggest things that we're thinking about.
The county schools in Anne Arundel, I think, have announced a decision to go all virtual for the rest of this calendar year. Were you involved in that decision? And was there any consideration to finding a way to bring some kids back at some times? Is there any way to do that safely?
Yeah. So the school superintendent and I, Dr. Arlotto, we've been in constant communication and looking at our data for our county, seeing how it was going up. I made the recommendation that we start the school year virtually. And our goal is to work towards getting kids back sometime in the fall. That's really important. We know that the health and the well-being of children is one of the most important things we need to focus on. So we're right now looking at what those parameters are to bring kids and staff back safely. And I think that's one of the key parts of this discussion is that there's some slightly different things we have to look at, whether it's kids or the staff, and they have different risk profiles. And so we're working through that. And our goal is by the end of August to have a tentative set of measures in place so that we can figure out when we can reopen.
Doctor, here's an email question from a viewer. Says the New England states are requiring travelers to have a negative coronavirus test. Massachusetts within 72 hours, Vermont within 7 days. How can we possibly comply with that?
This is the challenge of not having a national policy around this. when states are doing different things and trying to respond to their particular needs. Each state is trying to set up its own safety. There's right now a recommendation in Maryland state that if you travel out of state, that you get tested to know your status. I think that we have to remember that when you leave the state, all the things that we've been talking about in terms of masks and distancing and keeping your bubble tight, they don't go out the window. You need to keep doing those things, particularly because you're expanding your bubble by going out. So this is going to be a continuing problem in the absence of a federal policy.
Doctor, in your previous position, you were head of healthcare, I believe, for healthcare for the homeless, which obviously is serving underserved populations. Talk about those groups for a minute in the context of these disease, where avoiding catching it requires having a good mask, being able to get away from other people, isolate yourself a little bit, things that people in many disadvantaged communities have a much tougher time with.
Yeah, so that's something that we paid attention to pretty quickly after COVID. We had our first COVID cases in ARUNDEL. We focused on vulnerable populations precisely because they're at even higher risk than the rest of us. So looking at homeless populations, people in other congregate settings, like nursing homes or jails, and making sure that we are providing additional resources that are geared to those settings. So with the homeless population, one of the things that we did was to provide hotel stays for people who were homeless who we couldn't safely house in the shelter. We provided on-demand testing. We would actually go out to the shelters to test people if they had symptoms. We would provide the same for staff. We provided guidance and counseling for how to set up the physical space so that it was distanced and maintain hygiene. And it's that kind of approach to what we call health equity, making sure everybody has the opportunity for health, that says it's these populations, these folks are not an afterthought, but they're the focus of what we are working on.
Doctor, there was tough news today for medical members of the medical profession. The head of critical care medicine at Mercy Hospital passed away from the coronavirus. I know this is somebody you had come into contact with in your career. You just think about all the people who are gone to work every day, you and your colleagues, and everybody else who puts on a gown and a mask and takes this risk. He was a young man. He was in his 40s. And it's a terrible loss.
Yeah, Dr. Joe Costa, I met him a couple of times a few years ago and I was just touched by his compassion, by his thoughtfulness. I hadn't talked to him in a few years, and it honestly just hurt to hear of his passing. He was a good man, and he was working on the front lines of COVID, and it's apologies. It's just hard to think about, and this is part of why we really just beg and plead for people to wear their masks and to distance. It may seem like an inconvenience, but it is people's lives that we're talking about, and to lose someone who dedicated their life to helping others, it's painful.
I may have lost you for a second, but just in a couple seconds here, it does seem that when bad news hits, virus cases go up, people do get more serious, and I guess it's a time to do that. Just have time for a sentence.
Yeah, just remember that everybody's actions matters. Your actions matter. So please, please, please take care of yourself and others by wearing a mask and keeping distance.
Dr. Nilesh Kalyanaraman, sir, thank you very much.
Thank you, Jeff.
And joining us now for our Your Health segment is Dr. Sarah Crimmins, Medical Director of Labor and Delivery at the University of Maryland Medical Center. Doctor, thank you very much for joining us.
Thank you for having me. It's my pleasure to be here.
Let's start with how the pandemic is changing what you do, how it is affecting the experience for new mothers, and what expectant parents need to know about that.
So I think the biggest change that we're seeing is prenatal care has shifted its paradigm a little bit from a lot of in-person visits to more telehealth visits. So instead of coming to see the doctor 10 plus times during a pregnancy, a pregnant woman may end up having the doctor experience 5 to 6 times, and then having a telehealth visit the other 4 to 5 times. And we tell parents, soon-to-be parents and expectant parents, to be prepared for those kind of visits and have their questions ready, have weighed themselves before they come in, and make sure that they have taken their blood pressure, because that way they can really communicate well with their doctors and really have a meaningful conversation, even if it's over a video conference.
What's lost when you're doing visits that way? I mean, obviously, a well-equipped patient can do the things you're talking about, but you can't listen to the heartbeat.
There's probably the two things that people talk about. Is the one is the checking on the fetal heart rate. The other thing is when they do come in, a lot of times their significant others are not invited, so that them seeing the pregnancy or hearing the heartbeat is something that is a little bit lost. And we try our best to do that over media and things like that. But that experience of experiencing the heart rate in person is something that the patients are talking about that their significant others are lacking.
What about in the hospital, the delivery experience itself? How has that changed because of COVID-19?
So the biggest change in the delivery experience is there's the less of a number of visitors. So we used to ask only 2 to 3 visitors come for delivery. We are strictly keeping it at 1 visitor for delivery. So it's usually only the significant other as the birth support person for delivery, and all of the postpartum period. Usually we don't ask that visitors don't come and go. It means that grandparents, aunts, and uncles can't come to the hospital and see the baby right after it's born. They kind of have to wait for them to come home. And that's really just for the safety of the baby and the new mother, to kind of limit that traffic and make sure that everybody's safe and healthy.
Was there a notice, some sort of advice from the CDC at some point that nobody should come, that the new mother was going to be by herself?
So that type of advice has never been strongly suggested. There have been points in the last 4 months where, because of the hospital regulations and for safety and security of both the mom and the baby, that some hospitals have chosen to exclude visitors. But for the most part, we all know that a birth is a family experience, and we try our best to make sure that at least the significant other or one birth coach can be part of the experience to make sure everybody's safe and healthy and have some sort of positive experience from this.
What about testing for coronavirus? What's the experience been?
So at the time of admission for delivery, all of our moms are being tested for coronavirus. The reason is for the safety of the mom as well as the safety of the baby. This helps us guide the treatment for the baby aftercare, and as well as follow-up appointments and knowing what's going on at that time.
From what I've read, it's not entirely clear whether the mother, if the mother's infected, if the baby can become infected before delivery or after. I guess it's largely respiratory. What do you do in that situation?
So we know that there's a lot unknown in this situation, as you alluded to. We have been testing babies of positive mothers at 24 and 48 hours of life to see if they become positive. So far, none of our babies have been positive and have been very asymptomatic and well appearing for their postpartum periods. Out of an abundance of caution, moms who are symptomatically positive, we've been kind of suggesting that they separate from their babies to make sure that there's the utmost safety between the baby and the mom.
You know, the numbers nationally, the numbers in Maryland have shown a disproportionate impact on members of minority communities from the coronavirus. Do you see that in your hospital setting?
So we do. The majority of the patients who have come back in symptomatic actually have been either Latino or African American in descent, and that it's disproportionately higher in those groups as for the other groups. There's a recent study that came out that said up to 70% of the pregnant women that have been diagnosed with COVID and hospitalized were either Hispanic or Black.
Advice to expectant mothers. I mean, what do you do? I mean, everybody knows the common advice about distancing and masks. If you're protecting or social distancing for two, how do you think about that?
So it's tricky. There's a balance between social distancing for two, as you put it, and getting the support that a new mom may need. So what I tell moms is, social distance as much as you can. If you invite people to their house, invite 1 to 2 people at a time. Don't invite any large gatherings. Make sure that anybody that you invite over has no sick contacts, no ill-appearing symptoms, and keep those visits brief with hand hygiene. And, depending on the comfort level and the experience of the person that you're with, you may limit that to more than 6 feet away, things like that. Support family members, people who are coming to visit, can always help with bringing food, offering to run errands, things like that. And making sure that moms really have that support as best we can give them in this time where there's so much unknown, and just making sure everybody's safe.
Yeah, I guess, everybody wants to see the new baby, hold the new baby, but also everybody's highly concerned, about this situation. Even if the data would say that young people aren't affected, I mean, what are the numbers like for newborns?
So the numbers for newborns are actually pretty rare that they get infected. We do know that children under the age of 12 months have an increased risk of severe disease in reference to older children. So if they do get sick, they tend to be sicker, but they very rarely get sick.
What about the psychological side of this? We know that a lot of new mothers have postpartum issues with depression, mood disorders, that sort of thing. And this is an especially stressful time. I mean, you would just assume it contributes to that, does it?
Yeah, so we know that about 1 in 7 mothers get diagnosed with postpartum depression. So how will such an uncertain time change those numbers? Probably will disproportionately rise them. We know that anxiety disorders at this point are higher than they were 6 months ago, especially postpartum anxiety. I think that family members, friends of people who are having babies during this time need to really watch them and look out for them, and make sure that you're doing those mood checks for your loved ones and your friends, and making sure that you can help in any way you can, even if you can't visit, but a phone call or, dropping some food off at the door and checking on them is really important during these times.
Last thing I want to ask you, when the coronavirus started and everything was, suddenly locked down, you saw a lot of speculation in the news that 9 months later, we're going to have a baby boom. Is there any way to forecast that?
I think only time will tell, obviously. But I think that we will probably, what'll be interesting to see is how people will come in for prenatal care and present themselves for prenatal care. We've seen that early and frequent prenatal visits are the best way to prevent complications and prevent problems. So if you happen to have one of those post-COVID babies, make sure you come in and get prenatal care and come see us, even if we start your visits via telemedicine. But I think that probably the assumptions are right, and the numbers of pregnant women will be higher come New Year's 2021.
Sarah Crimmins, University of Maryland Medical Center. Doctor, thank you very much.
Thank you for your time. Have a nice night.
And finally tonight, high honors in Washington for Representative John Lewis, the civil rights pioneer. Mr. Lewis became the first black lawmaker to lie in state at the U.S. Capitol Rotunda. Last year, Maryland Congressman Elijah Cummings was similarly honored in Statuary Hall. Maryland Congressman Kwelsi Mfume paid tribute to his congressional classmate. He and Lewis were first elected in the same year.
Birthed in an era of Jim Crow and vile and vicious segregation, he defied the limitedness of others' expectations. John knew that politics changed people, so he set out early to change politics. Everything about him pointed to the fact that he was emblematic of that great band of freedom fighters who realized that freedom wasn't free.
Representative Lewis will lie in state at the Capitol tomorrow as well. Funeral services are set for Thursday. Mr. Lewis was 80 years old. And that is Direct Connection for this week. We're back Friday with State Circle and the latest on Maryland politics. Remember to follow us on Twitter and Facebook at MPT News. And you can see videos of our recent programs, including last week's special on race and policing, online at video.mpt.tv. Thanks for watching Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.